Good afternoon, ladies and gentlemen. On behalf of COVID Academic Research Consortium, or ARC, led by Dean Ronald Mendoza, we welcome you to the first series of webinar on international best practices on the fight against COVID-19.
Good afternoon, ladies and gentlemen. Mei Shang Ho speaking from Taipei. With the past few months of ongoing spread of the disease throughout the world, we all have come to the understanding and accept the fact that this disease is not going to be eradicated by our current available control measures. As I just now present to you that the pandemic is likely to last for months. So what we do, we try to slow down the transmission. At the meantime, give us the opportunity, the time to find better tools to combat the disease.
COVID-19 is a very serious threat to human life and economy. One very creative measures by our Taipei City government is we provide a smart tracking system in cooperation with the village chiefs to make sure those individuals who are under the home isolation or quarantine will stay at the hotel or their residence. So we have to help each other to open our doors, and then we can recover the traffic between the different countries.
We got a lot of questions from the participants, but first, we'd like to thank our two speakers for those information that you shared. Number one, is Taiwan actually developing its own vaccines? Is it also doing plasma therapy? What are the other treatment protocols that have shown somehow promise or actually worked?
First of all, yes, there are several groups of vaccine developers, including two companies. They are vaccine companies. One is based on their platform of pandemic preparedness of H7N9, and the other one is the other company collaborated with US NIH. The second of all, the question is whether we use plasma therapy. Yes. Then thirdly, whether we have some better regimen. Oh, sadly, no, we don't have a better regimen than what's currently known. There's no stringent side-by-side comparison of clinical trials, so we don't know which one is better, which one works.
Some people are asking about how Taiwan was able to manufacture so many masks such a short period.
At the end of January, government decided to mass production the surgical mask. Before that time, Taiwan is the number 3 largest surgical mask production country in the world. We immediately ordered some surgical mask making machine from West Germany. Now Taiwan can produce roughly about 17 million surgical masks per day.
This next question, I think, should be answered by both of our speakers. The question is, how would you assess the performance of the WHO? And can you elaborate on how Taiwan deviated from the WHO's recommendations, but led to positive results in containing the spread of the virus?
Every year, one of the most important activity is we try to re-enter or try to go to WHO to provide our medical expertise. Unfortunately, because of the political interference from China, Taiwan won't be able to even participate in WHO, that is World Health Assembly. I think they pronounced this pandemic too late.
Under the current WHO, IHR, international health regulation, it always recommended that refrain yourselves from travel ban. Taiwan, knowing full well that we have 1 million people would return from China, although these are our own people, we have to accept them, but we would reject any Chinese nationals from Wuhan at very early stage. So I think that's really an early deviation.
Thank you very much, Dr. Ho and Ambassador Cho, and very much to Mr. Christian Esquera for moderating this quite interesting open forum. The key lesson for today, as I would gather, many people have said that science and politics should never come together. They should be really separated. But in situations like a COVID pandemic, the two disciplines have to consider seriously how to cooperate really for the public good. Thank you very much and have a good day. Please stay healthy and safe.